Thank you, Mr President. I rise on behalf of the Greens to welcome this legislation and the fulfilment of this government's election commitment, on top of course, a national commitment that will allow real-time monitoring of the prescriptions or supply of drugs of dependence. Indeed, the key focus of this legislation is harm prevention, and that is a welcome one indeed. The Controlled Substances, Confidentiality and Other Matters Amendment Bill 2020 is a recognition that prescription drug abuse is a rising problem in our nation, and pharmaceutical drugs have been significant contributors to overdose deaths. Prescription drug abuse is a worldwide problem of increasing concern to governments and, of course, the United Nations. Research data indicates that prescription drug abuse is increasing in Australia. The 2013 National Drug Strategy Household Survey found that 4.8% of Australian adults use pharmaceuticals for non-medical purposes in the past year. That is an increase from 3.8% in 2004. The number of people in needle and syringe programs who reported that the drug they last injected was a prescription opioid increased from 7% in 2000 to 23% in 2015. The importance, therefore, of a real-time prescription monitoring system is highlighted and indeed echoed in an article published in the Australian Family Physician, that is a magazine of the Royal Australian College of General Practitioners. In an article titled "Prescription Drug Abuse, a Timely Update," the authors noted that, quote, "Regulatory changes in pharmaceutical medications can have an impact on patterns of drug prescribing and subsequent misuse. Implementation of real-time monitoring programs may assist doctors in making more appropriate prescribing decisions." This is the very same article which highlights the statistics that I've just quoted. I'm pleased to see that South Australia, as the rest of the country are, is moving to addressing this issue. The passage of this bill would, I believe, make us the third jurisdiction in the country to have a system that is compatible with the national database. Victoria's system is almost implemented, and Queensland is a month or so ahead of us. Currently, the ACT has a limited version of such a system in place, and Tasmania has a system that allows for almost real-time monitoring, but isn't yet linked to the national database. This bill, of course, is largely administrative, with enabling amendments that will see us implement script check here in South Australia, as well as allowing the system to connect to the national database and collect information in real time. In an overdue leap into the 21st century, this bill also allows for doctors to make applications for authority to prescribe drugs of dependence via the script check system, rather than having to mail in a physical form request, as is the current practice. This will allow for better information being available around what drugs are being prescribed, by whom, for whom, and at what frequency, and also allows doctors and patients more timely access to those prescribed drugs. The changes to penalties under the Act are appreciated as the amendments ensure they are more proportional. And this bill allows for expiations on larger offences to support the system that will be in place. This is quite useful as, for example, the only way currently to address someone not submitting their data is to take them to court. Now, this bill will enable for there to be warnings and the possibility of a fine without that offence being recorded, as opposed to taking that individual to court for what should be more an administrative approach. I particularly appreciated the added clarity that doctors and pharmacists can only access information in the database for the purposes of treating a patient, and that health practitioners can only share information with others providing treatment, and that SA Health as the government regulator. It was deeply concerning to learn in our briefing that some of the behaviour of SAPOL officers who have engaged in demanding information from health practitioners under certain pretences, then going after the individuals to whom the information related to for something else entirely other than their health needs. So it is very welcome to see an assurance for practitioners, for health practitioners, that they will not be required to share that information relating to the prescription of drugs of dependence to SAPOL. I have a question for the Minister, and I would like perhaps it taken on notice because I didn't give prior notice of this question, but in the past 5 years or 3 years, depending what is the easiest data to collate, how many times have SAPOL attempted to put that pressure on our health professionals with regards to this information about the prescription of drugs of dependence. This bill is timely, and we look forward to its swift passage and implementation. It is indeed good to see our systems being brought into the 21st century, albeit 20 years in to the 21st century, and also that harm minimisation approach to tackle the very serious issues of dependency on prescription pharmaceuticals. And I must note that as a subscriber of the SANDS, the Australian Network of Drug and Alcohol Services email list, which I have been for well over a decade, well before I was a member of this place, in my previous roles, particularly as Policy Officer for the Mental Health Coalition, that this bill has been well consulted, and that currently there's an email out which is specifically consulting on those practitioners who are directly affected with regards to the regulations. I find it extraordinary that the Labor opposition would come in here as if we normally look at the regulations that are associated with an Act before we pass a bill to create that Act. It is extraordinary to gild the lily a little there, as if somehow that is common practice. And I do note that if the opposition was so minded, there's a whole website devoted to information on this process. And indeed, the website is very cognisant that some of our health practitioners have had a little thing called COVID-19 to deal with just lately and have had a lot else on their plate, but are currently being asked for their specific input onto how they will be affected and whether or not they need exemptions from the operations of this Act. So, with those few words, I commend the bill to the Council.